I will be doing a morning med pass demonstration today. I first ensure privacy of the patient and safety of the patient. I would check the bed, make sure that it's locked, side rails are up, call light is in place, all of that. I have verified my medication orders from the doctor. So I will come in and introduce myself to the patient. Hi, my name is Melissa. I'm a student nurse today. I will be giving you your morning medications. Can you verify your first name, last name, and date of birth for me, please? Okay, perfect. I'm just gonna check your armband here. Harry Truman, 1/19/1974. Very good. I will perform hand hygiene. And at this point, I would assess vital signs. Some of the medications that are given this morning do include blood pressure medications and things of that nature where vital signs are important to have. I'm checking my meds again and checking the MAR. I will check expiration dates on my meds, the names, and the dosages of the medication to be sure that is correct. Mr. Truman, do you have any allergies other than sulfa? No? Okay. I've reviewed his lab work prior to coming in. I'm going to also check his blood sugar while I'm here before I start my med pass, because one of the medications this morning is insulin. So we need to have a blood sugar, fasting blood sugar, prior to giving the insulin. Ask the patient if they have any questions for me, and then I will proceed. Hand hygiene again. And apply gloves, because I don't want to touch the patient's medications for fear of cross-contamination from myself to the medication or the medication rubbing off into my skin. All right, Harry, this morning we have a couple pills for you. We have furosemide, 40 milligram tablet. This is for excess fluid in your system, kind of help alleviate some of that. So with this medication, I'm going to assess fluid status. That would be my intakes and outputs, if I am able to get those. I would check the weight of the patient if I'm able to do so. I would check for edema in the lower extremities, and listen to lung sounds to note any kind of fluid. I could also check the skin turgor to see if the patient is hydrated or dehydrated. So that's that. The next medication I will be giving is pantoprazole, 20 milligram tablet, once a day. I would ask the patient about any recent bowel movements. I would inspect and palpate the abdomen as well. It is important that this medication is given 1 hour before other medications or 2 hours after, because of the rate of absorption would be changed. So I would give my patient their medications. I have 2 pills here, furosemide, 40 milligram tablet, once a day, and pantoprazole, 20 milligram tablet, also once a day. I would give them a full glass of water and visualize them taking the medication. The next medication we will take is insulin. So I will turn this around so that this is visible. I'm going to ask the patient about the last site used to inject insulin. I will assess those areas if possible to check for inflammation. And ask them if they would like to self-inject or if they would prefer I inject. Insulin goes into the subcutaneous layer that is on the abdomen within 2 inches, at least 2 inches away from the umbilicus, the back of the arm, or the thigh. So I'm going to cleanse my tops here. As I'm doing that, I'm verifying that I have the right insulin. The expiration is within date, and that they match my medication order. I have an insulin syringe. I know it's an insulin syringe because it's measured in units, and it also states insulin right on it. So open that up, and the patient is getting 5 units of insulin N and 5 units of insulin R, which will be mixed together. One is fast acting, one is intermediate acting. So I'm going to draw my plunger back for a total of 10 units of air. My insulin N is going to be cloudy in color. I will just swirl this in my hands for a few seconds prior to administering. The needle goes into the N first. I expel 5 units of air. Withdraw. Then I insert it into the insulin R. Expel the remaining 5 units of air and draw up 5 units. Ensuring that there's no bubbles. And then I will draw up the insulin N, 5 units. Again, making sure there's no bubbles. While I'm doing this, I can talk to the patient about proper diet, low carbohydrates, low sugar, simple carbs. Talk to them about the importance of being active and exercising. Even 30 minutes a day would be beneficial. And I can also talk to them about fluid intake, that they should ingest at least 2 liters of water a day. So in this situation, I'm going to recap this temporarily. I would cleanse the area of the abdomen in a circular motion. Wait for it to air dry. And tell my patient on the count of 3, I'm going to poke. I would also make sure that I squeeze the area of subcutaneous fat, like so. And then slowly inject over a time period of about 5 seconds. Flip the guard up on my needle and dispose of it in the sharps. would dispose of my gloves, perform hand hygiene, ask the patient if they have any questions or concerns for me, and allow them to know that I will be back in about an hour to finish doing the rest of their morning medication. Another thing to know about the insulin is because one is rapid acting, I would need to have food available to the patient within 15 minutes of administering the insulin. Part 2 of my morning med pass. It has now been an hour since I was in the patient's room previously. First thing I'm going to do is monitor for signs of hypoglycemia, being that I gave the insulin about an hour ago. The next thing I'm going to do is introduce myself, ensure privacy and safety, all of that. The next thing I'll do is introduce myself. Hi, my name is Melissa. I'll be your nurse today, giving you your morning meds. Can I get your first name, last name, and date of birth? Perfect. And then I'll check the wristband just to verify. Harry S. Truman, 1/19/1974. Very good. I'll perform hand hygiene and reassess vital signs. The medications I will be giving this morning pertain to blood pressure and the heart and pulse, so I will want to evaluate those. When I'm doing the vital signs, I'm also going to check the apical against the radial pulse in comparison for the digoxin. For the metoprolol, if the pulse is below 60 or the systolic blood pressure is below 90, I need to hold the med and notify the provider. For digoxin, if the pulse is below 60 or above 110 or irregular, I also need to hold the medication and notify the provider. I would check my medications, make sure I have the correct medications, the correct dosing, check my MAR to make sure that everything matches accordingly. I would again verify allergies. We know he's allergic to sulfa. And I've already reviewed lab work. So patient has got some high blood pressure, pulses within range. We're going to go ahead and administer the medication. So I'll perform hand hygiene and apply gloves. The doctor has ordered metoprolol, 75 milligram tablet once a day in the morning. That is for your blood pressure. He's also ordered digoxin, 0.25 milligram tablet, 1 tablet in the morning. That would be used for AFib or congestive heart failure. And he's also ordered Bactrim, 1 tablet. But that one I'm going to hold off on because my patient is allergic to sulfa, so I will be questioning the doctor about that order before I administer. So I'll get my medications ready. Digoxin, 0.25 milligram tablet, 1 tab. And metoprolol, I have available in 50 milligram tablets, and the order is for 75 milligrams. If this is a scored tablet, I can break this in half. If it's not a scored tablet, I need to refer to the ordering provider just to make sure that I'm giving the correct dosage to the patient. So if I was splitting the tablet in half, I would give the patient 1.5 tabs. I will administer the medication with a full glass of water. Ask the patient if they have any questions for me and address them as needed. I'm gonna educate my patient to rise slowly when getting up out of bed or out of a seated position due to the blood pressure medication, as it could cause orthostatic hypotension or even just hypotension, some dizziness, and they could fall. So please use your call light prior to getting up, and at home just rise slowly. Take things slow until you know how the medication is going to affect you. I would also educate them on how to count their pulse using their wrist, how to feel for their pulse, locate it, and how to count it, and to count it for 1 minute prior to taking those 2 medications, the digoxin and the metoprolol. I would dispose of my gloves, thank the patient, exit the room. My patient is now ready to be discharged. The doctor has ordered an influenza vaccine and a TB injection to test for TB. So I verified my order. I've come in and I've introduced myself to the patient. Hi, my name is Melissa. I'm your nurse today. I will be getting you ready for discharge. First, we have to give you a couple of injections prior to you leaving. The doctor has ordered an influenza vaccine and a TB. Can I get your name and date of birth, please? Check the wristband again. Perfect. Perform hand hygiene. And I'm gonna assess vital signs just as a good measure. Every time I'm in contact with a patient, just making sure that their blood pressure is within normal limits, their pulse is in normal limits, their respirations, all of that. Okay, I'm verifying my medications on the vials to make sure that it is the correct medication. And I've checked it with the MAR and the order, so that's done. I'm going to assess for allergies again, making sure that the patient's not allergic to eggs because of the flu vaccine. That's important. So I will do the flu vaccine first with the patient's permission. Hand hygiene, apply gloves. The flu vaccine is an intramuscular injection. There are 4 sites that are possible to use for those injections: the deltoid, the vastus lateralis, which is the thigh, the dorsogluteal, which is towards the buttocks, and the ventrogluteal, which is more towards the hip. So, I will cleanse the top of my vial. With another alcohol swab, I would cleanse the patient's skin. In this demonstration, I'm going to use the deltoid, which is 3 fingers below the acromion process, the little bony area here on your shoulder. So I've cleansed the patient's skin, I've cleansed my bottle. I will put together my needle and syringe. And the order states 0.5 mLs. So I'm going to draw it up to 0.5. Move my safety lock. Remove the cap. Insert. Expel the air. Invert and draw up 0.5 mLs. Make sure that there's no bubbles. Perfect. So this injection, depending on the patient's body type, would be anywhere from 45 to 90 degree angle. I'm going to use the Z-Track method. So I'm going to go in just like a dart and slowly inject. Lock my safety, dispose of it in the sharps, apply a Band-Aid, do not massage the area. I will then dispose of my gloves, my trash, just so I have a clear working space. So that's in the trash. Then I will do the TB, but first let me educate the patient. Your arm may be a little sore and stiff for the next day. Just try to really move it, like you're rowing a boat. That'll really help with that. Now we'll administer a TB. So I'm gonna hand hygiene, apply gloves, the TB injection is an intradermal injection. It goes just under the surface of the skin. We're looking for hopefully no reaction, meaning that the patient is clear and does not have tuberculosis. I would instruct my patient that we are not to cover this spot. Don't itch, don't apply oils, lotions, things of that nature. And it needs to be read by a nurse or provider within 48 hours. So I'll check my medication. This is tuberculin, 0.1 on my order. Okay, I will cleanse my bottle with a different alcohol swab. I will cleanse the skin. So in this area of the forearm is usually where these are given. And this is for 0.1 mLs. So again, draw out my plunger, find 0.1 on my syringe. Got it. Insert, expel the air, draw up 0.1. Ensure that there's no bubbles. Look for the bevel of the needle because that is to be up. I would hold the skin taut, bevel up, inject, little poke, just above this, just below the skin there, and slowly inject. And I should see a wheel form when I'm administering this. Lock the safety and apply in the sharps box. Remove my gloves. Hand hygiene. I'm also going to make note to the patient as part of their discharge instructions that the doctor has ordered warfarin 2.5 milligram tablets every day at 5 o'clock. I would discuss with the patient the increased risk for bleeding with this medication, to limit foods high in potassium such as your leafy greens. It's also important to avoid grapefruit, alcohol, and cranberry. There's also an order for simvastatin 20 milligram tablet. That is for cholesterol. I would instruct my patient to take this at bedtime and follow a well-balanced diet. I'd ask my patient if they have any questions for me. Ensure their safety, call lights in place, beds locked, handrails are up, and they are comfortable, and I would exit the room.